And one of those is, in order to take advantage of the qualifying event, you have to notify us, either call us or come see us, tell Lisa something, get in the system. You have to tell us within 30 days of that event. So if you get divorced 3 months from now, you have 30 days from the date the judge signs the divorce papers to tell us you need to make a change. If you miss that window, unfortunately, you're locked in. You could potentially be kind of stuck paying for your spouse's health insurance on the plan until next open enrollment. So just think about some of those things and let us help avoid making some costly, timely mistakes. Any questions about open enrollment? Again, everything we're talking about today is going to start fresh on July 1. Next page is just a visual showing all of the different plans now that are offered through the city. We've added a couple. Last year we added the identity theft protection and the emergency transport protection. In the center, we've added a graphic for the EAP, which is an employee assistance plan. There's a new one this year that's very robust we'll talk about towards the end. But this is kind of my reminder, honestly, to tell you at this point that you can customize this package to fit whatever you need for your family this year. So if you don't need your kids on the dental anymore, you can take them off and you can leave them on the health plan. If you don't need your spouse on the health plan, but you want your spouse on the dental and the vision, you can do that. So as long as you, the employee, have each coverage, you can elect which dependents you want to have on the plan and which ones you don't, okay? So you don't have, it's not a one-size-fits-all where if I have my spouse on my health insurance, she has to be on everything else. It's not like that. So you can be customized to whatever you need it to be. As far as dependents go, spouses, any legal spouse, regardless of gender, are eligible. Common law spouses are eligible. Domestic partners are eligible. And then as far as your children go, any child, stepchild, or child that you have guardianship of, legal court documented guardianship of, can stay on your plan until they're 26 years old. So all the way till they're 26. Any questions about those things before we jump into the medical? Pretty much that's all. Same old story we've been talking about for several years. Just like to touch base on it because we have some new faces and some young faces in the room that may not know how all the rules work. All right, so talking about the medical plan. As you can see, this year we have 2 options instead of 3. We have been moving in this direction for a few years since Blue Cross built out this new network called Advantage, and they've made it so robust where most providers are in that network. That network, unfortunately for the providers, pays those doctors less than the old preferred network did. So it's contracting stuff, it's insurance stuff. So they've negotiated for all of you and any of us who are on Blue Cross plans, they've negotiated lower rates to pay those providers, which saves you guys money, saves the city money in the premium that we pay for that coverage, okay? So as that network has gotten more robust, most of our customers have moved over to the Advantage network fully in the last few years. We've been tracking that with the city and who's utilizing doctors that are in that older preferred network. And it appears to me there'll be very little disruption to go ahead and move everything towards the Advantage network this year. That being said, if you were on the preferred network before and you need help searching any providers, that is a service we can provide for you and are happy to do that to make sure that any doctors or LPNs or anybody you're seeing now to make sure they're still going to be in this network if you're moving to it for the first time. This first benefit in the middle column there, it's the 0073 number. That actually is a much richer benefit as far as what the plan pays or how much you would have to pay out in claims than that preferred plan was. So again, we've been kind of trying to educate everybody. Like this is actually better as far as how much money you would have to pay out if you had a surgery or something. And then we still have the other plan on the far right side that's a little less expensive for those of you who want to add like full family coverage and just need, less money out of your paycheck, but you still want a good health plan. So the things to focus on these health plans in my eyes are the dark blue bold numbers towards the top where it says out-of-pocket limit. I like to focus on this because this is, in my eyes, what you're actually paying for when you buy health insurance. This is your financial protection. So this is your all-in worst-case scenario. Excuse me. So the out-of-pocket limit on Plan 1 is $1,250 per individual in your family. And then on Plan 2, that increases up to $3,000. So regardless of how sick you are, how many claims you have, how high those dollars get, on Plan 1, you wouldn't pay more than $1,250 for the entire calendar year in claims. This is where it gets confusing because we're starting this all new July 1st, but your claims and your deductibles started accumulating back in January. So we're talking now calendar year. I just flipped the script on you, right? This is why people get so frustrated with insurance. So everything you've been accumulating, some of you may have already met that this year. You're not starting over with a new deductible, new out-of-pocket limit on July 1. It's going to continue on whatever you've been accumulating since January. Couldn't be any more confusing, right? On Plan 2, that jumps up to $3,000. So even the $3,000 plan in my world, that's still considered a platinum plan and the best level of coverage that you can buy. The average in our book of business in the state of Oklahoma and in the country at large is between $5,000 and $6,000 depending on region and industry. So you guys are still, even with the higher plan, the higher benefit plan, you guys are still at about half of what most average plans are offering their employees. That's one reason why it's so expensive. But I know, we all know, that city employees aren't paid as much as maybe somebody working at Google or some big tech company, somebody downtown Tulsa. So it's part of your compensation package to offset that. Okay? I think you guys all understand that already. That's why you're here, because you have really good, one of the reasons why you're here, because you have really good benefits. Okay, so the deductible, we can backtrack. The deductible is a number, either $500 or $1,000 per person. That's really only something you have to worry about if you go to a hospital or any kind of facility where you're getting something big, like an MRI or CT scan or a PET scan, or if you're having outpatient surgery. So think of like facility, hospital, surgery center-based type claims. That's typically where we see you having to pay that deductible up front if it's not an emergency. Everything that you do on the day-to-day basis is what we call first dollar coverage, and those are usually more your small co-pays. So down in the common services section in the center boxes, in the middle section, of course your preventative care, like we've said for years, by law now since Obamacare, your plan has to pay for all of your wellness type visits 100% with no cost to you. So your colonoscopy if you're over the age of 45, mammograms, pap smears, prostate exams, cholesterol checks, diabetes, blood sugar tests, all of those things covered 100% once a year by your plan. You should have zero cost for that as long as you stay in the network. If you get a claim, which is common, not super common, but it does happen, and your doctor, it looks like they're billing you for those services, that's a good time to get us engaged and we can find out what happened. The trick is when you go in and you're expecting your free visit, you tell your doctor that's what you want. I'm here for my wellness visit, my free checkup, my whatever you want to call it. I want all the free stuff. The stuff by law I get for free. Anything beyond that, Mr. Doctor, Miss Doctor, before you do it, I want to approve it or not. Because sometimes they can do things there that, you know, are kind of feeling like a checkup, but they aren't the ones covered by law. The other trick is if you go to your doctor and he says, well, how you feeling? You're like, well, I've been having some problems with my stomach, you know, this and that's happening. And now it's no longer preventative because now you have a symptom and they're diagnosing something to go along with that symptom. So just be careful. Again, if you want that, if you have the expectation of my free visit, be loud and clear about that. I just want my free stuff. And then if you start talking about symptoms and, you know, diagnosing what's going on that's causing those symptoms, you need to start asking questions. How much is this going to cost me? And, you know, talk about the insurance side of it. Is that making sense? Okay, so that's the kind of things that we deal with every day that sometimes people get angry about. We try to get ahead of, just so you know how the system works, so we can help save you some money. The other thing you can use on your plan for no charge is the telemedicine. So, you know, you have urgent care here. You want to go there instead of the emergency room anytime you possibly can. But now you can call and talk to one of Blue Cross's contracted doctors 24/7, 365, absolutely free. As long as you have one of those phones in your hand, you have access to a doctor. You may have to call and leave a message. They usually call back within 2 to 5 minutes. But let them know what your symptoms are. If you think it's strep or urinary tract infection, poison ivy, they can diagnose that kind of stuff over the phone or via video chat and prescribe your medication. You just run down to the pharmacy and pay your copay for your medication. Okay? So make sure you guys are using that. I know my team, they've used it from the office. They don't have to leave and go to urgent care. It's just really convenient, and that is something else you won't be charged for. You can use it as often as you want to. The other things you can do on the plan, because they're just so small dollar copays, Is your doctor's visit, depending on which plan you use and what type of doctor, you'll be paying anywhere from $20 on the low side up to $45 on the high side for a specialist. Your labs and x-rays that are all in conjunction with those visits, there's no charge for those either. And then your urgent care, if you go there, it's $50, all encompassing for everything they do. All the testing, all the x-rays, all the labs, everything at the urgent care is $50. They shouldn't be billing you for anything outside of that, okay? Everything else, your surgeries, your emergency rooms, your hospital stays, your physical therapy, mental behavioral health type services, all that kind of stuff, if it's inpatient or at a facility, that's where you have to worry about paying your deductible, the 20% that follows your deductible. But at the end of the day, your maximum is either the $1,250 or the $3,000 that we talked about in the beginning. Okay? I'm feeling sleep deprived, y'all. I feel like I'm kind of talking in circles today. Down at the bottom, let's talk about prescriptions. If y'all used to seeing me normally do this, I feel like I'm like my low battery lights on. My apologies for that. Down at the bottom of prescriptions, they're exactly the same on both plans. The list of prescriptions that are covered, how they're covered, all those prior authorizations and all that step therapy stuff, it's the exact same